The first question, is it possible to diagnose endometriosis without surgery? The short answer is yes. It is possible to rule in endometriosis through imaging tests, including advanced ultrasound or MRI, that is done and reported by an expert in endometriosis. The longer answer, endometriosis imaging has been advancing over the past years to a point where we can reliably rule in deep endometriosis, ovarian endometriosis, and sometimes even the most mild form of endometriosis, superficial endometriosis, through imaging tests. Again, when it's performed and reported by an expert who has done advanced training in that imaging modality. One can also get a bit closer to a diagnosis through what we call the clinical diagnosis pathway, whereby if your signs and symptoms, particularly things such as cyclical period pain, non-menstrual pain, pain with intercourse, infertility or subfertility, should these things be in existence within you, then it can lead us to what we call a clinical diagnosis, though that is presumptive and not necessarily confirmed, unlike when imaging or surgery visually sees endometriosis with our eyes. But surgery is no longer required to confirm endometriosis if it is reliably diagnosed with imaging. It is not necessary to have surgery or even technically an imaging diagnosis to initiate medical or complementary alternative treatment options, as that clinical diagnosis can help initiate some treatment options to work on the symptoms.